Okay, bestie, welcome to another episode of Nurse Me Through It, where we cram from the same notes we cried over and somehow still pass. Today we're talking law, ethics, and delegation, the nursing trifecta of don't lose your license.
Seriously, this chapter is like a legal and moral landmine field. But don't worry, we're gonna break it all down without making it feel like court TV.
Let's start with the basics. Laws are like the official rules. They're written and enforced by the government, meant to protect both the public and individuals.
And in nursing, there are 6 types of law you need to know: constitutional law, rights from the Constitution; statutory law, laws passed by lawmakers, like the Nurse Practice Act; administrative law, made by state boards and agencies; criminal law, crimes like stealing meds; civil law, disputes between individuals; common law, based on court decisions and tradition.
If you ever said, this feels illegal in clinical, it probably falls into one of those.
So let's talk about torts, which are civil wrongs. There are 2 flavors: intentional, like assault, battery, false imprisonment; unintentional, like negligence or malpractice.
Let's say you give a med without consent. That's battery. Lock the bed rails and don't let a client leave AMA. False imprisonment. Forget to check allergies and give the wrong drug. Negligence.
So what's the T on negligence and malpractice?
Negligence equals any action or failure to act that causes harm. Malpractice equals negligence by a licensed professional. So if a nurse messes up, it's not just sloppy. It could be malpractice.
To win a malpractice case, you need proof of duty, the nurse's responsibility standards; breach, they didn't meet the standard; harm, the patient got hurt; causation, what caused that harm. Usually was from the breach.
This is why nurses need malpractice insurance. Hospitals will protect themselves, but you've got to protect you.
Your own liability insurance helps with legal fees, settlements, professional representation. And there are ways to reduce liability too: good documentation, knowing your scope, following policies, using incident reports, and knowing Good Samaritan laws.
Okay, switching gears, let's talk ethics. Because just because something is legal doesn't mean it's ethical.
And vice versa. Sometimes what's ethical feels illegal.
Like respecting a DNR, even when the family is begging you to do compressions. Totally legal, but emotionally hard.
Ethics equals moral principles guiding what's right and wrong. Code of ethics equals official list of what ideal behavior looks like. Ethical dilemma: when you're stuck choosing between 2 bad options.
So, like, a nurse might feel ethically obligated to give a patient more pain meds, but legally, you can't. That's a conflict between ethics and law.
There are 2 major ethical theories: teleology, also known as consequentialism, which is the outcome is what matters; deontology, the duty or intention matters more than the result.
So, if saving one patient means another one might die, teleology says save the one with the best chance. Deontology says do what's morally right, no matter the cost.
These are your core principles for ethical care: autonomy, respect the patient's right to choose; beneficence, do good; nonmaleficence, don't harm; justice, be fair; fidelity, keep promises; veracity, tell the truth.
And don't forget confidentiality. HIPAA is the law, but ethically, it's about trust.
Let's list some real nursing ethical dilemmas. Truth telling: do you always tell the whole truth? Confidentiality: what if the family asks questions? Withholding treatment: when is it okay to stop care? Advance directives: what if the patient wants something the family doesn't? Code status: DNR versus full code. Whistleblowing: reporting unsafe practice. Scarce resources: who gets what when there's not enough?
That's why we have ethics committees. They help with big, complex decisions, so you don't have to carry it alone.
Nurses are also guardians of patient rights. Let's see if we can list the patient's rights: right to privacy, right to be informed, right to refuse, right to competent care, and right to make decisions.
And if you're not protecting those rights, you're risking legal and ethical problems.
You can say that again.
All right, babe, let's talk delegation. Because if you give the wrong task to the wrong person, you are liable.
So, who delegates? An RN's job isn't to assess, plan, teach, evaluate, and give IV meds. An LPN is able to stable patients only, reinforce teaching, and give oral and IM meds, and also the jobs of a UAP. UAPs can perform ADLs, vitals, and non complex care.
The LPN cannot assess, teach, or touch unstable patients. The UAP can't interpret anything. No judgment calls.
Let's memorize this about delegation, the 5 rights. Right task, making sure the person you assign your task to is able to perform it. Right circumstance, making sure the patient isn't critical. Right person, make sure you're treating the right patient. Right direction, communication, make sure you give clear instructions. Right supervision and evaluation, make sure you're checking the work is being done correctly. You are responsible for the patient no matter what.
If you don't remember this for the test, remember it for your license. Because when you delegate, you're still responsible.
So let's recap. Being a nurse means knowing these things: the laws that protect and govern you, the ethics that guide your actions, and the scope that defines your safe practice.
And if you ever forget, just ask, is it legal? Is it ethical? Is it in my scope?
That's how you keep your job, your license, and your sanity. That's all for today on laws, ethics, and delegation.
Catch you next time on Nurse Me Through It. Let's stay ethical, delegated, and unproblematic out there.
Now go past that test, babe.